My name is Mashrur Rashik, and I am a PhD candidate at the University of Massachusetts Amherst. I work with Dr. Narges Mahyar and Dr. Ali Sarvghad at the HCI Viz Lab. In this video, I will present our CHI 2025 paper on AI-enabled conversational journaling for advancing Parkinson's disease symptom tracking on behalf of my co-authors Shilpa Sweth, Nishtha Agrawal, Saiyyam Kochar, Kara M. Smith, Fateme Rajabiyazdi, Vidya Setlur, Narges Mahyar, and Ali Sarvghad. Conversational journaling is a technique for gathering patient-generated health data in which patients interact with a digital system in natural language. It is useful to document patients' health and daily experiences. These systems can potentially recreate essential elements of the clinical interview to capture in-depth patient information using targeted question answers. Furthermore, conversational journaling can be paired with voice modality to reduce accessibility barriers for those with motor disorders. Prior works have shown conversational journaling to improve patient-provider communication, support accurate diagnosis and treatment planning, and promote self-reflection and long-term care for chronic conditions. Parkinson's disease is a chronic progressive movement disorder. Regular journaling can help people with Parkinson's disease enhance self-reflection and actively participate in clinical decision-making process. Journaling helps capture their symptoms frequently that vary and fluctuate throughout the day and requires frequent monitoring. Journaling captures detailed insights on medication effects and side effects. For instance, long-term use of levodopa, one of the most effective medications for managing motor symptoms in Parkinson's disease, can lead to the development of dyskinesia, characterized by involuntary and erratic body movements. Therefore, collecting and communicating detailed information about PWPD's experiences is essential for optimized treatment plans. Existing solutions to track PWPD experiences focus on using wearable and sensing applications to track quantitative data, diary applications that support passive quality data collection, and tools that support static data entry using conventional data entry forms. These solutions primarily target motor symptoms and overlook non-motor aspects, lacks bidirectional personalized interaction as seen in clinical interviews. Finally, PWPD face unique challenges that often make current journaling tools ineffective. Motor symptoms such as tremors, which are involuntary rhythmic shaking that typically begin in the hands or fingers, can make writing or typing difficult. To address these challenges, in this work we designed and developed Patrika. Patrika is an intelligent electronic journaling system that provides Parkinson's patients with a simple and intuitive interface for recording their symptoms. Patrika is voice-enabled and can be accessed via Amazon Alexa. The system incorporates cooperative conversation principles, clinical interview simulations, and personalization to create a more effective and user-friendly journaling experience. There are three major components in our journaling system: the natural language understanding or NLU module, the response generation module, and journal module. The user initiates the conversation with Patrika. Patrika acknowledges the user's input and asks them what they want to record. In this example, we assume that the user wants to record their tremor. When Patrika receives the user input, it passes it to the NLU module. The NLU module compares this input to the predefined list of intents. The intents align with our design consideration to understand medical terminology. The NLU module predicts the intent that best matches the user's input, like tremor in this example. This follows Gryson maxim of relation. The NLU module then passes the predicted intent to the response generation module. The response generation module first acknowledges the user's input, following our design consideration and Gryson maxim of quality, relation, and manner. The response generation module then iterates over a list of follow-up journal prompts and selects a relevant journal prompt that hasn't been asked yet. This process of selecting follow-up prompts aligns with our design consideration and adheres to Gryson maxims of relation and manner. Next, the response generation module creates the journal module with the predicted intent and prompt to retrieve relevant user conversation history. The journal module retrieves a list of relevant conversation history, following Gryson maxim of relation, and then passes it to the response generation module. The response generation module personalizes the journal prompt using the conversation history. In this example, the prompt includes details about the user's medication. This follows our design consideration. The response generation module then processes the personalized prompt to Patrika. The user then continues journaling their tremors with Patrika. To evaluate Patrika, we recruited 8 PWPD with the assistance of our team's neurologist and 2 local Parkinson support groups. The study consisted of 3 stages: an onboarding session where participants completed the pre-study questions, reviewed the system tutorial, and read instructions on how to participate in the study. Next, the participants took Patrika to their primary place of residence and used it to journal for 2 weeks. After the study, the participants completed a post-study interview where they provided their feedback. To analyze the journal data, we performed qualitative analysis. We manually reviewed the collected journal session, and 3 authors transcribed and quoted the post-study interview. Our findings revealed issues with Patrika's performance. We found low performance of the intent prediction model due to a previously unreported birth journaling behavior in which the participants' entries covered a wide range of topics: voice-to-text transcription errors by Alexa, and low generalizability of the intent prediction model to the participants' diverse input. Next, we found issues with personalization, where the response generation module failed to dynamically adapt to the user's profile. Our post-study analysis also revealed that the system did not provide sufficient signal regarding status, such as when it is preparing a response versus waiting for one. Based on these findings, we made improvements to Patrika. We updated the NLU module to use in-context learning for intent prediction. We updated the response generation module to use rules for journaling. We improved personalization using retrieval augmented generation. We incorporated audio feedback to ensure that the participants are aware when the system is preparing a response. We conducted a second user study using 9 participants. Amongst them, 6 were returning participants from Study 1 and 3 were newly recruited. With the exception of the updates made to Patrika and minor adjustments to the onboarding session, the design of Study 1 and Study 2 were identical. We collected 251 journaling sessions from Study 2. 3 team members performed qualitative analysis of the participant and the system responses. Our findings revealed that, on average, Patrika was able to accurately interpret the participant's input and provide relevant responses to engage participants in coherent, health-related dialogue. We also found that the participants provided relevant responses to Patrika. The results also showed that the responses from Patrika were personalized, with an average personalization rate of 81%. Our qualitative analysis of the journaling sessions and the post-study interview revealed that Patrika captured both direct symptom references from the participants and indirect anecdotes regarding their experience. And the journaling's frequency and sessions varied with personal circumstances. We also collected feedback from 2 clinicians and movement disorder specialists who confirmed the data's usefulness in supporting care for PWPD. We discussed how tailoring journaling questions to the patient profiles enrich data collection, the utility of cooperative dialogue, empathetic responses, and personalization to promote a human-like connection, the challenges in intent prediction using LLMs, and the use of data analytics to improve the utility of the collected data. Thank you.